Is cefazolin, also known as antibiotic or anti-infective. The onset is 10 minutes, peak is at end of infusion, duration is unknown, dosage is 250 milligram to 1 gram every 8 hours, and daily dosage is 12 gram max. And some common side effects going to be nausea, vomiting, dizziness, fevers and chills, and headaches. And some severe common side effects going to be serious common side effects going to be dyspnea, and also some results going to for the lab result, for example increase of AST, ALT and BUN, and also some rashes. Yeah, and at this point I would be going to agency's policy, medication policy. I would have checked I would have taken two relevant policy for this medication. And now I'm going to go ahead and check doctor's patient's chart and sign the signature sheet here. And I put the dates here, my full name, status, and signature and initial. So I'm going to go ahead and check some medical history for my patient. So I see the name is Seth Garland. He is 68-year-old. He is 2 days post-operative, and he experiencing complication due to infection. Yeah, and he's the past medical history also. He 2 years ago he had myocardial infection, and then peripheral neuropathy, coronary artery disease, and he's also type 2 diabetes, and he has asthma. And patient's wound is purulent and draining excessively. That's why the doctor ordered this antibiotic for him to help. And also I will be checking for the viral sign and IV site, and also the lab result for that. And now I'm going to quickly check the doctor's order with the MARS to compare the steroid information I got here. And patient's name is Seth Garland. Seth Garland, medical number is 34-4316, 34-4316, November 8, 1965, November 8, 1965. Allergy is codeine penicillin, allergy is penicillin codeine, and the drug is cefazolin. It's also the start IV is also here at 125 ml per hour, and also the new drug is for cefazolin 500 milligram, dosage 500 milligram, and it's IV. And with this IV, it's every 8 hours. For frequency is every 8 hours. The reason, as I said, is for post-operative. And then also he's on another medication that is says enalaprilate. It's 1.25 mg. It's also IV medication, and it's every 6 hours. And I have to also check for the IV monograph for medication complication, med-to-med complication and all that. And I have to also see for patients' lab values before administering the medication, and also after administering medication, to monitor and see how thing goes. And so for that, I will be now going to check my IV monograph here. And also I wanted to check what happened to what is the appropriate infusion for the cefazolin is. So I see that it's diluted in 50 to 100 ml of IV solution and infused over 10 to 60 minutes. And I will choose 30 minutes because my patient has allergy of penicillin and codeine. This is also related, and it's also antibiotic, so I choose 30 minutes so I have enough time if there's any reaction, so I can help him well. And I will also check for compatibility and stability. It's reconstituted and it's stable for 24 hours at room temperature, and then it's a normal saline, and it's also premixed by pharmacy here, and still it is a normal saline. Yep. And the comparable at Y side is the another medication that he is on. It says inabilalate, and also I wanted to see in comparable at Y side, for also see the main line is right there. We know that this is they are compatible at the Y side, and therefore at this moment we are not worried about that. So now I'm going to quickly check my main line first, and of course I'm going to do hand hygiene before I enter the patient's room here. So I see my main line is here in ACL 0.9% at 250 ml, and then expiry date is June 2020, and I see the infusion line is all straight up, and then I see there is a label at 125 ml per hour as per doctor's order. I see the tubing is properly labeled. It has a start date and time, and the initial for the nurse initial, and I see the line is straight. There is no leak or anything. Straight to my patient's second left-handed here, and as I'm here, I'm gonna do my pre-assessment here. So I'm looking for any leaking, any skin tag, or I don't see any sign of phlebitis or any inflammation or redness here. And I also see that the skin is not warm to touch, and looks dry and clean, and there's no edema here. And if there was any edema, whereas edema has warm to touch, and this one doesn't have anything. So I also see while I'm here, I'm gonna see the left leg here, left leg for any checking for his left leg for any drainage, and also compare the infection. I wanted to see how it is started with the line, and then how it started, and then how it's going to affect while I'm helping caring for him. And so I'll come back to my medication's room. So I will check here. So I see my medication. I also check here. This is 0.9% sodium chloride, 50 ml, and it looks clear. There's no drainage, there's no hole in it, there's no dripping or anything. It's good to go. And then I see two expiry date here. Expiry date is October 19th, 2020. And also I also see another expiry date from pharmacy that it says December 2020. So now I'm go ahead and checking with comparing with the mark here. So the patient's name is Seth Garland 344316, 344316, November 8, 1965, November 8, 1965. The allergy is penicillin coating that I noted that here. So the medication that I'm going for my 8 rights, it's cefazolin, dosage 500 milligrams, and added by pharmacy. Frequency is every 8 hours, and the reason is going to be for because he is post-operative infection. He has post-operative infection, and the time is going to be 1400 at this moment, and the site is going to be on his left hand. So, and there's also a special instruction for this. This is ordered for 7 days. This medication. So then this medication has a start and a stop date, and this is already started 2 days ago, and today this medication is the 3rd day of the 7th day. So I'm done with my first calculation. Quickly going for my second calculation here. So it's Seth Garland 344316, 344316, November 8, 1965, November 8, 1965, and the drug is cefazolin. Dosage is 500 milligram, and the route is IV. Route's IV frequencies every 8 hours. The reason is for post-operative infection. The time is going to be 1400 and the site is going to be on his left hand. So since I'm done with my second check, I'm going to take a piece of paper and do my calculation. And the calculation is going to be 2 steps. Total mil over total minutes 10 60 mil per hour. So my total email is going to be 15 email from the package. Over the time is going to be 30 minutes because I chose it from IV monograph because of his allergy. Minutes 60 minutes equal. Okay, so 50 divided by 30, 60. 30, 60. It's 100 mil per hour. Part 2 calculation is going to be because of the gravity, we're calculating the calibration. So it's volume over time, CGTT per minutes. So again, it's going to be, my volume is going to be 100 mil over the time is going to be 60. The times the calibration, the 10 from the package, 10 GTT per minute. So now I'm going to be 100 divided by 60 times 100. So it's 16.6666. It's repetitive. So now I'm going to convert it to 17 GTT per minute. Circling my answers. So I will be taking picture and then submit it with my videos here. So now I'm done with my first calculation. I'm going to do my third check here. Third check, Seth Garland, 344316, 344316, November 8, 1965, November 8, 1965. This patient has an allergy of penicillin. The medication has cefazolin. Dosage is 500 milligram. Route is IV. Frequency is every 8 hours. The reason is he is post-operative and the time is going to be 1400. The site's going to be on his left-handed. So again, I'm going to take my piece of paper to do my calculation again. Total over minutes, 60 minutes per hour. That's 50 ml from the package over 30 minutes that I choose from the IV monograph. 60 equal 50 divided by 30 times 60. 100 milliliter per hour. Circling the answer. The second part for calculation is going to be for the volume over times calibration is CGPT per minute. So again, it's going to be 100 milliliter, 60 times the calibration is going to be 6. The calibration is going to be 10 from the package. GTT minutes. We'll divide by 60 times 10. It's 16.6666 repeating. So I'm changing to 17 GTT per minute. So okay. So at this moment I'm done with 2 calculations here. I would have asked my tester to come in and check it for me since I'm good to go from here. And now I need my medication and a ball swab and need the infusion line. Just gonna do hygiene here. I'm going to take it. Immediately checking, and the line looks good here, and immediately going to lock it. Fusion line lock, and keep this sterile. Open this. Open that. Keep it sterile here. Sound good. Now I need the hook, ball swab, my mark, and my pen here. I'm going to patient's room now. I'm going to introduce myself. Hi, my name is Zahra. I'm a student nurse from Durham College, and I'm here to do your IV medication. Is that okay with you? Okay, thank you. And before doing that, can you let me put this on here first of all. Let me change the medication here. And I'm going to put this to connect it first of all here, since the patient, since he gave me permission to do so. I will take the alcohol swab, clean it vigorously for 30 seconds, and then let it dry. And it says dry now. Then hook this, tighten it, and so okay. And can you please tell me your full name and date of birth? Seth Garland, and okay, date of birth November 8, 1965. Okay, thank you. Do you have any allergy? Penicillin codeine? Okay. What happens when you get penicillin codeine? So you get a rash and itchy. Okay. Yeah, also this medication has some common side effects. Like for example, it's nausea, vomiting, headache, dizziness, and also if you also you some patient may feel shortness of breath or rashes, and then if you feel any of these, if you experience any of those, please use your call and then let me know. So now I'm going to calculate the rate for that. I'm going to take 4 minutes to calculate the rate for that. So first I'm going to open all the line here, make sure all the lines are open here. So it's halfway. Going to put this back here. Okay. And taking the main line. And so now I'm going to calculate the rate for that. There's 17 drops per minute here. Okay, perfect. So it is 17, exactly 17 drops per minute here. While I'm here, I'm going to check his left leg to see how the infection is looking like, if it's excessive from before, or it's getting better, and to document on his chart. It's then I will also, I would have, at this moment, I would have done before infusing, I would have done my environmental check at the moment. Also, I would have, I already said that I already checked his vital sign here, and I will keep, and the first, I'll tell my patient that in first hour, I'm coming every 15 minutes to check on you, and then before that, if you feel any, as I said, if you feel any shortness of breath, or any itchy, or any chills or fever, please let me know. Use your call and let me know. So I will keep my patient safe, clean, and comfortable, and I will perform hand hygiene and take the herbs here, and I will put the, I'll document the medication on the mark, the initial my name and the 14 hours, and left-handed, and that would be my